Hi, I'm John Lesher, a musculoskeletal physiatrist with Piedmont Healthcare. My practice is mostly focused on the non-surgical treatment of spine and musculoskeletal or orthopedic injuries. Today's video is a follow-up video on platelet-rich plasma. I did a previous video on this earlier last year and received a lot of good feedback from it, and also a lot of follow-up questions. So today's talk is going to be on the use of PRP, or platelet-rich plasma, for treating knee arthritis, and I'm the patient. I have always enjoyed living an active lifestyle, and in my younger years I did a lot of sports with lots of jumping, mostly basketball and volleyball. Unfortunately, the best years of my jumping career are behind me. As I've reached middle age, I've experienced more and more knee pain in both of my knees. Currently, my right knee is giving me a lot of pain. Currently, I'm experiencing what I call a dry flare-up in my right knee. This involves generalized achiness and pain in a global distribution across my whole knee. I don't have one area of pinpoint or specific tenderness, but just a generalized deep ache. I know my knee gets more sensitive when I sit for a long period of time, typically 30 minutes or longer, and then go to a standing position. My right knee won't be as fluid and it'll feel somewhat stiff. I will then favor my left side to help unload my right knee. Sometimes during my knee flare-ups, I will experience puffiness or swelling in my right knee. My current symptoms don't involve that, and that's why we call it a dry flare-up. Overall, the knee joint is achy, painful, and stiff, but I'm not really experiencing much swelling or puffiness. I also don't experience locking, catching, or significant instability, but it does interfere with my regular activities, especially if I want to go for longer walks or hikes or work outside in the cold weather. I've received various treatments for my knee pain. This has included corticosteroid injections as well as gel shots, or what we commonly call viscosupplementation. The steroids felt wonderful for about 3 weeks. After about a month, my pain started to return. I then tried the gel shots or the viscosupplementation. Unfortunately, those shots have not helped me, but I still offer both of these treatment options to patients. Additionally, I've done lots of therapy for my knee, and I continue to do exercises for it today. That includes mostly strengthening of my hip, gluteal or buttock muscles, and my thigh muscles. I'm also a big or avid walker, and I enjoy walking briskly with a good upright posture and at a good pace. I also do stationary cycling. Both of these activities, the walking and cycling, help keep my knee moving and fluid as much as possible. As platelet-rich plasma, or PRP, has been used more regularly to treat orthopedic conditions, we're learning what dosage works best for what types of patients and what types of indications. So just like a patient that has high blood pressure, they may respond to a higher dose of medication instead of a lower dose medication. With regards to the use of platelet-rich plasma in orthopedics, the knee joint has been the most heavily studied joint to date. There's regular studies being published and released on a weekly, if not monthly basis. More recently, over the past couple of years, a lot of study has focused on the dosage of platelets and what's ideal for treating a patient with mild to moderate arthritis. More recently, the literature or research has shown that approximately 10 billion platelets is good for treating mild to moderate arthritis. What I mean by good is that that dosage of platelets has been shown to have pain relief or provide pain relief for patients out to 1 year, if not longer. In our lab, when we draw blood for the PRP procedure, we will obtain a baseline level of platelets. So what's the normal level of platelets circulating in your blood? We will then concentrate the blood solution into a concentrated solution of platelets. After we concentrate the blood, we take a sepal sample and run the platelet numbers as well, so we can see what the baseline platelet numbers are, as well as what the concentrated platelet numbers are. To find out the total volume or the total amount of platelets that we inject into a joint, we multiply the volume of PRP or platelets given to the patients by the individual concentration, and that gives us the total number of platelets, or what we call the dosage. Again, Studies today are showing that higher platelet dosages are better, and with the knee arthritis in that mild to moderate category, approximately 10 billion platelets is where we want to be. There isn't any harm to injecting more platelets. I'm commonly asked, are more platelets going to harm me or be more beneficial? And really the science hasn't shown us that more platelets are more harmful. We also haven't determined that more platelets are significantly more beneficial. So this is an area that research is continually being done on. As a reference in our labs, when we are injecting larger joints like a knee joint, a hip joint, or a shoulder joint, we will typically draw 60 to 120 milliliters of blood. Remember that the larger amount of blood we draw, the more platelets we can concentrate for healing purposes. I'm commonly asked what's involved with the platelet blood draw and procedure. This whole process is typically done within an hour of your visit to our clinic. We will draw your blood, and while or after the blood is drawn, we will take you to the procedure room as you'll see today, and ultrasound will be used or fluoroscopy will be used to evaluate the soft tissues or the joint. Once we evaluate it appropriately and the blood is ready, then the procedure is done and usually takes less than 10 minutes. To make the process as smooth as possible, we strongly encourage patients to keep themselves well hydrated before coming in for a procedure. So if you're coming in first thing in the morning, drink plenty of fluid the night before as well as that morning. This allows for an easier blood draw. We also encourage a light meal before the procedure as well. We also encourage discontinuing typical anti-inflammatories for typically 1 week before the procedure. These medicines are commonly Aleve, naproxen, ibuprofen, and can inhibit a platelet's function. We will also hold off on these medicines for approximately 2 weeks after the procedures, and I will provide supplemental pain medicines to patients if needed to maximize their comfort. What does it feel like after the procedure is another common question I'm asked. Remember that when we inject platelets into a joint, they will release a lot of proteins, and these proteins are stimulatory. So it's not unusual for the joint to feel somewhat more pain or aggravated for approximately 24 to 72 hours after the initial injection. This is very different from a corticosteroid injection that usually within the first few days is feeling much better. During the first few days to 1 week after the injection, we recommend light activities, and we always provide a very detailed physical therapy note to provide to a therapist to oversee your rehabilitation. We don't really want to stress or heavily load the joint or tendon, especially in that first week after the procedure. Specifically for my knee joint today, I will continue to do light walking over this next week as well as stationary cycling. As long as my pain is improving over the next 7 to 10 days, I will gradually increase those activities. The knee joint injection really doesn't affect my overall upper body workouts or core workouts. It's just mostly focused on lower body stresses. Please note that the post-procedure rehab for a procedure really depends on the area that we're targeting. For joint injections, we can usually advance the rehab more quickly than if we're doing a soft tissue injection like a tendon or ligament. For tendons and ligaments, we usually will protect those areas for a longer period of time and then gradually load them over a longer period of time as well. Again, this really is patient dependent and depends on how the patient is feeling with regards to their pain and activity level. Whenever we're considering a PRP or platelet-rich plasma procedure, I'll always get imaging of the joint that we're targeting. That will usually involve x-rays, an ultrasound, and/or an MRI. For my knees, I recently had x-rays done for both of them this week, and I'll go over with you what I'm seeing. So I have pain in both of my knees, but my most severe pain currently is in my right knee. So this is my right knee here, and I'm looking primarily at the joint spaces and then comparing it to the left knee. My right knee shows some mild narrowing here on the inside. This is what we call the medial compartment. It's actually slightly worse on the left side. You can also see a small little bone formation or bone spur forming there, not as prominent on the left side. I have meniscal tears in both of my knees, And because of that, that can hasten or lead to knee arthritis. And currently, I think a lot of the symptoms that I'm experiencing now are because my menisci are injured, primarily more so on my right side, and that is stressing the underlying cartilage and making my pain more frequent. These are different pictures of my knees. My right side is here, my left side, and looking at from this vantage point is looking at it from the side. And I'm most concerned about the space behind my kneecap on both sides. There's more narrowing on my left side, which can go along with some of the pain that I have there, but my right side is relatively wide open. We just finished the concentration process of the platelets. And to remember, we took 120 cc's of my blood and then concentrated it down to about 6 cc's. And that's what you see here. I like to say this is the golden healing power of the platelets. So tremendous amount of blood, removed the vast majority of the white cells and red blood cells, and now we have the platelets. And this is what will be injected into my knee joint. So Angelina has sprayed my knee. It's nice and numb right now. And now I'm gonna guide the needle into the joint. So I'm gonna make some small little adjustments here. So what we see here is that I'm in the knee joint and it's just going into the knee joint without a big deal. And then I'm just keeping it in place centrally, and it's just going in. Good, and then we're all done. So with this type of injection, it's just going mostly into the joint. With some types of injections, you can target different structures, not only the joint, but the surrounding ligaments and soft tissues for more comprehensive injection treatment. For this, I just wanted to solely put it in the joint because since I was doing it myself, it's much easier that way. I hope this video has been helpful in improving your understanding and knowledge of the platelet-rich plasma procedure. If you have any questions, please feel free to contact our office. You do not need to have a specific referral, and you can call us directly. We're happy to provide any more information for you. Thanks for watching.